Okay. Good evening, everyone. You are welcome to this inaugural weekly meeting by IAPHL Nigeria. My name is Pharmacist Chisomoye Melukwe, and I'm going to be the anchor for this event. And I'm delighted to invite here Dr. Kabiru Goma, who is here with us. Dr. Kabiru, we welcome you to this lovely event. So I will talk briefly about Dr. Kabiru Goma. Dr. Kabiru Goma is a public health practitioner with over 11 years of experience working in international organizations, starting from the internship at Howard University Pharmacist and Continuing Education Center to becoming the state's implementation team pharmacy specialist under the FHI 360s project titled Strengthening Integrated Delivery of HIV and AIDS Services. Subsequently, Dr. Kabiru was the logistics advisor with John Snow Inc. and supply chain management system specialist with Management Sciences for Health. Thereafter, he worked as the state logistics coordinator at Axios Foundation, implementing the maternal, newborn, and child health program, and later as the warehouse operations manager in the same organization. Currently, he serves as an adjunct professor with Euclid University, and we are very delighted to have you, sir.
Hello, good evening, everyone. I'm very happy to be here. It's very surprising that I'll be the first to be interviewed. It's a great pleasure to meet all of you on this platform. We've been meeting on WhatsApp, but it's a pleasure that you're meeting on another level. Thank you.
Thank you, Dr. Kabiru. I hope you're having a lovely day, and thank you very much for granting us this interview. And even though I have done the introduction, we still want you to, kindly introduce yourself in the best way possible.
Okay, thank you very much. I go by the name Kabiru Abubakar Gulma, but shortened Kabiru Gulma, first name and last name. I am a pharmacist and I work in the public health setting for nearly all my career. I work in supply chain setting for quite some time before moving into the broader health system strengthening, with now focused responsibility in the aspect of governance and leadership of health system strengthening. My special interests have been anything relating to supply chain, public health, assessment of public health programs, data analysis and visualization, and then writing, of course, not really articles, but research papers. I have many of them in the aspect of public health and specifically supply chain program. So my interest is not different from what you know, actually, supply chain, public health, and then more of research now that I have two affiliations, one as an assistant professor at Euclid University in Gambia, and then I'm also an adjunct faculty at Chandigarh University, India. So my main career is what I do here in Nigeria, but the background, I have an academic career moving for quite some time and it's still moving. So this is who I am. Thank you.
Wow, that's very, very impressive and quite intimidating for a young supply chain enthusiast like as myself. So amazing. What was growing up like? What would you say was the influences that shaped you into the role model you are now?
Okay, yeah, great. So I grew up in Kebbi State, Nigeria. That's my state of origin. I was born in Birnin Kebbi and I started schooling in Birnin Kebbi. Some of the things that shaped my career actually were at Berea College Zaria. And I think at the end, I emerged as the best graduating student in chemistry and in sciences. I applied to Ahmadu Bello University Zaria for pharmacy, and as God will have it, I got the admission. My initial dream was actually to be a clinical pharmacist. Also, from the beginning, I used to have flair for writing. I also have this small background of writing. I think I started writing to Pharma News, if you know Pharma News, the only pharmaceutical journal we have in Nigeria. I first wrote to them in 2005, and I was writing to them because of the consistency. They offered me a column named Pharmacy and Information Technology. I think from 2005 up to 2013, that is almost about 8 years I've been writing to Pharma News. So I don't even know the number of articles I wrote in Pharma News. So after graduation, we have a 1-year compulsory internship program. I applied to National Assembly Clinic, Abuja, and I actually got it. So they used to have this program. They have external posting to other to other facilities, because what they have there is clinical settings, so they want interns to have experience of other settings. So I think my first posting was to IAPHL, and I think I was there for some weeks. That was when I got to know about the HIV/AIDS program, that is the GAIN project. I think we received series of presentations, orientations, and we helped them with data entry and things like that. So after that posting at IAPHL, I was posted to St. Mary's Catholic Hospital in Gwagwalada, and I was specifically posted to ART unit. So it's more like a continuation of what we are taught in IAPHL at Gwagwalada as well. So but the work in Gwagwalada is more of a supply chain, that is logistics, counseling patients, data entry, and subsequent reconciliation. So after that, I had a delay going for NYSC. So I think as of that time, I was finishing my internship. KB State now absorbed some of us into the civil service. So before I was mobilized, I actually reported. And on the first day of reporting at the Ministry of Health, the Director of Pharmaceutical Services said, like a certain project came. The name of the organization is FHI 360, and they have a project, a new one, strengthening integrated delivery of HIV/AIDS services. So they came here requesting for a pharmacist, and you're the only one I have here that doesn't have portfolio, so I gave your name. So I think he gave me an invitation letter to attend their orientation. And after attending the orientation, the work is in partnership with the state. So it's not a kind of full-time work. It majorly centers around report collection, around supervision and things like that. So while they are not in KB, I concentrate on my posting at the hospital. So you know how civil service is, having studied pharmacy and have so much expectations about how an ideal system should look like, and how I expected everything to be in line, to be people to be very objective, and the role I play to be impactful. So from that point on, I knew that working with the government is not for me. So shortly after I was mobilized for NYSC and I was posted to Sokoto, I was posted to Ministry of Health, and because we were co-implementing the CIDAS project with them, they knew me, and so I continued the CIDAS even in Sokoto. So I think just about a month before our passing out parade, I saw this advert with Jon Snow Incorporated, and I just gave it a try. So after the second interview, I was actually offered the role. It was a consultancy position, logistics advisor, to be based in Sokoto, but to be supporting the 6 or 7 northwestern states: Sokoto, Kebbi, Zamfara, Katsina, Kano, and Jigawa. So not up to a year into the consultancy, the organization advertised full-time positions, and were encouraged to apply. So I applied, and I also got the job. So that was how the series of events shaped my career into coming into supply chain full-time.
Yes. So like in summary, like you had opportunities and you grabbed them. So I think that's what I've taken up from what you said. Like when it gives you opportunities, make sure you grab them. So what do you think are the basic health supply chain problems in Nigeria from your experience?
Oh, there are quite a number of them, but let's start from the most important one. I can say the funding, because except for where the government runs the RF, or where they run, I can say free Medicare, you realize that most of the commodities moving into health facilities are usually from the donors. So for all the experience I have working with different partners, there used to be a kind of plan for co-funding, where the funding for donor ends, the government should take over. But that hasn't always been the case, because government hardly releases money for drugs, actually, even though it's in the budget, but releasing it is an entirely difficult thing. For instance, now in KB, I work under the CID Integrated Health Program. GHS CPSM supply our commodities, but the commodities supplied do not meet the demands. So there used to be a quantification, and then this is what donor is bringing, this is what is expected to be in the state's budget. Even though it's budgeted, it's hardly released, but we are making frantic effort to see that at least a release is made to complement what the donors are supplying, because you see, one day donors can shift priorities and they can even exist. So without government coming in to fill in the void, there will be a huge gap and a catastrophe. So apart from funding, another thing again that I think is a challenge is the transportation of the commodities from maybe central warehouse to the last mile. All along my career that I know, except for one project that I worked in Kasina, where the government has kind of stepped in, most of the transportation costs for the commodities are borne by the donors. So that is a challenge on itself. So let's take a look at the warehousing as well. To the best of my knowledge, most of the warehouses we run are not farmer grade. Some are just better than others, and some, if you assess them based on the storage indicators of logistics, you will know that they haven't met those storage conditions. So even the storage place is a very huge challenge. And then again, the reporting, I wouldn't say tools are scarce. We have issues when they are scarce, they can be improvised. But the issue of recording and then writing accurate data that may inform either resupply or procurement, that is also an issue. Then in some other instances, especially when free drugs are involved, accountability is usually a very huge challenge that most of the time needs government to be on its toes in order to ensure that the drugs are not pilfered or they are not sold to clients whom are meant to be given for free. So these are some of the supply chain challenges I have noticed in my career in supply chain.
Okay, so that's very nice. So based on your experience, how can you relate, okay, the supply chain system in Nigeria? So, but how do you think we can achieve a sustainable system, really? How can we achieve a sustainable system?
I think we are on the way because through my career, there have been so much innovation. For instance, when I joined John Snow, I know I was part of the team that pioneered the regional logistics management coordination units in the Northwest Zone. And subsequently, we supported KB, Sokoto, Jigawa, and Kasina to start the LMCU from the scratch. By the time we were in the region, Kano already had its own. So I think the first point of sustainability is that coordination mechanism, and whereby the state is in charge, and it is located in the Ministry of Health and oversees or has knowledge of all the supply chains running in the states. So over time, LMCUs have evolved from maybe just one or two persons to becoming a team of program officers of both partners and the states, working together, implementing the programs, collecting reports, informing resupplies, and also monitoring and supervising health facilities where the supplies go to. So the key issue here is coordination, and then the government being in the coordination that will also inform sustainability. So I think we are on track, but we need to actually improve because some of the key challenges I know about this ownership and sustainability, I can't say is the capacity gap, because most of these people in LMCUs have attended most trainings as you and I. So it's just the system where they find themselves to be with little or no motivation, and then no, can I say, enough funding to help LMCU to function on its own. In the LMCU, really in some states, I know some states have started having budget line, but I can't recall if any has been released that will inform their independent activities from what partners are bringing on board. Because most of the time they leverage on partners for supervision, for report collection and other things. So they need to be empowered in the system in which they work for them to properly own all the public health programs running in the state. So that issue of funding is very key, because without it, even if they know what to do, even if they have a vision, even if they have a blueprint, they can hardly implement it because there is no fund to finance whatever they can do. So most of the things partners can do, they can also do it. They can quantify, they can procure, they know all the storage best practices, they know all how to make distribution plans, they know about LMIS, they know about report collection, they know about resupplies, they know most everything they do, but they have to have the enabling environment in terms of infrastructure, equipment, and funding in order to keep their job going. And this has to be continuous. It shouldn't be this year government release and next year is an issue again, because getting government to release money continuously, except for their routine works, is very difficult. So I think we are on track, but we need more effort in that direction. Considering where we came from with no LMCUs to LMCUs having more people, partners domiciled in LMCUs becoming units in the Ministry of Health, LMCUs having budget lines. So we need to work on funding, continuous and sustainable funding for LMCUs. Thank you.
Okay, so sir, as a senior IAPHL Nigeria mentor, what would you say to young people like us, like me, that are starting up in supply chain system? And what would you have done differently with your career progression so far? What do you think should have been done differently?
Well, what I would have done differently, I can say, to God be the glory. So far, so good. Most things worked well. No matter how good something is, there should be a room or areas for improvements, actually. So I would have been more focused. And one thing with this our supply chain career, and especially working in NGOs, is the opportunities that present themselves, actually. So since you cannot initiate your own system with no funding, you have to be in a system that you can make a contribution. So I considered having a master's degree in supply chain and project management, which actually I started within the very shortest possible period of time, and I completed in very good time. So I wanted to continue in that line, but at the time I wanted to progress to a doctoral level, I don't think PhDs in supply chains have started emerging that way. So I had to revert into public health. And what I will advise young professionals, of course, you are not young, you are as good as me or even better than me. In life, it's good to have a vision and to know what you want to become. And in every circumstance you are, you should tailor what you do to what you want to become. For instance, before now, I just have an ambition of becoming an academic, but not a full-time lecturer at this very young age. So despite the fact that I don't work full-time in university now, I happened to read pharmacy and came into the supply chain. I was able to progress my career in supply chain and subsequently into the broader public health. I was able to publish, for instance, my master's thesis, which is on supply chain. I think I assessed the soft status of cotrimoxazole in the HIV program of Kebbi State that time. Then also for my doctoral research, it's on public health, but I also tilted it towards supply chain by assessing all the public health programs in Katsina State. I think it was an expansive research that I accessed over 900 facilities and applied the LIAT tool. And so you see, I was actually in public health, but my eye has already been in supply chain. And I was very cautious of not to do, for instance, an MPH, which is a professional master's that could be a problem later if I want to join academics. I specifically went for a Master of Science in Public Health after my supply chain degree. I also went for a PhD, not a Doctor of Public Health. And whatever I do in supply chain, for instance, even in JSI, where in Kano, we supported the state to do a quarterly stock status report for HIV and TB. So we encouraged the state to publish it. I supported them and the paper got published. And when I was in Katsina, we continued with the quarterly stock status report, this time around for all the supply chain systems running in the state, with the exception of none, I think about 9 of them. We did that consecutively for 5 quarters, and we kind of made a trend analysis. And there was this Africa Healthcare Delivery Conference, and I think that was coming to Abuja at that time. We submitted an abstract, and we were given the room for a poster presentation. So we were still in supply chain. We're doing our little research with the data we have, and we're still publishing it in the hope that someday we'll become experts in the academic. So after my doctoral as well, I was lucky when I graduated. I was retained as a faculty in the School of Public Health and Bioethics. And even though here in Nigeria locally, I work in public health, in the academics. Yeah, in the academics, but they have also begun to identify me as somebody who works in the supply chain. So most students that have anything to do with pharmacy supply chain, they have been directed towards me. And from that, you see another university in India. I don't know how they came to know about me. They wrote me, they want me to join their faculty, and I was also. So there is this international research collaboration the university is looking for on SDGs, and I think we have theory that relates to health and well-being, and different topics were being proposed. And somehow I was the first person to submit a proposal under public health. So I was made to kind of be the overseer of all submissions on public health. So vision is very good and focus. It doesn't matter where you are, you have to have a vision and work strategically towards it. It will not be one day, of course, but you need to know the steps that will lead to that, and you need to be very focused about it. So I will advise upcoming professionals to be very focused, to be very dedicated, being very professional. Let the work speak for you. You don't need to be the one explaining about your work. If your work is good, it will sell itself, and people will come for you, will come for advice, and you can be even made an overseer or somebody to oversee the kind of quality assurance of a particular issue. Thank you.
Thank you, sir.